I think in terms of integrated vector management globally, about 62% of the countries we have surveyed has a policy on integrated vector management. Now the challenge we face along the way is how this approach is accepted by the ministries of health and how that approach is funded to combat multiple diseases. So one of the key steps is to reorient a program, strengthen entomology, make sure the programs are reoriented in such a way that all vector-borne diseases comes under the same umbrella and you follow the integrated vector management approach. Yeah, we are talking about mosquito-borne diseases in general, and there are tools which we deploy or use for mosquito control which can be shared by multiple disease programs. So if we really do that sort of approach, we save money, the resistance problem can be addressed jointly, and there will be a more cost-effective measures put in place. I think with a significant political commitment, we can get a program going in about 2 to 3 years' time. But again, that I am factoring in the need for capacity development, for the need for reorienting the program at all levels of the health system, and then making sure that these reporting systems work in such a way that there is no duplication of work, but they work in parallel and we are able to share the resources. It is really, I would say, the IVM is nothing but an approach of how to combat vector-borne diseases. So under IVM, we have 5 key pillars, which includes advocacy, social mobilization, and getting the political commitment, capacity building, evidence-based decision making, making sure there is intersectoral collaboration. So all these, and of course monitoring and evaluation part. So all these things are the key pillars by which we are implementing vector-borne disease control programs. So IVM is nothing but an approach, and we are making sure that this approach is followed for sound management of vector-borne diseases. I think the most important thing here is we have reviewed some new tools which can be used, and so naturally that sort of review would feed in to the upcoming meeting in Geneva, where we are looking at new tools for vector control which can be scaled up in this emergency situation. The second important point I really wanted to appreciate here is that this is the first meeting of its kind of a tag for entomology, and this is a very timely, and I am really glad to note that PAHO has taken the lead in it, and I hope I can quote this as an example to other regions to follow, basically to strengthen entomological capability. Well, actually the tools which we will review next week are all in advanced stages of evaluation. They are all on the final step where they have to really pass the epidemiological endpoint, that sort of situation. So they have been critically evaluated by the Vector Control Advisory Group and are in quite an advanced stage of development, and all these tools have been in the field for 5-6 years. Right. So there is a wealth of data which I am sure they will present to make sure that they can address the concerns of the Vector Control Advisory Group. So they are quite mature tools. There will be a recommendation to WHO, and the recommendation of Vector Control Advisory Group has to go to the policy making body of WHO. For example, in this case, if it is a tool for Aedes control, it goes to our strategic and technical advisory group for neglected tropical disease for their endorsement, and that group can make the final decision on policy. Right. But at this emergency, since this is an emergency meeting, I think the recommendations our senior management will review it faster and see how that goes.